Hey guys, welcome back. I'm Ken Peters, speech pathologist, owner of Miami Speech and Swallowing Center. This is part 2 of a 2-part series on breathing exercises. If you haven't seen part 1, please go to our YouTube channel and view part 1, which reviews stretching, which is so important prior to initiating exercises, and the importance of nose breathing. Part 2 today is going to be going over resistance-based exercises. If you have an underlying medical condition, please consult with your physician prior to initiating these exercises. This will increase your heart rate. This will be resistance-based, so it's going to be difficult and challenging. But I will show you how to pace yourself, how to modulate the loading level or the effort level in the exercise, and let's get started. We will now be starting the first exercise, which is a maximum breath hold. Now, a lot of the exercises that I'm doing today are meant to be done at home. I'm home right now due to COVID-19, and all the exercises that I'm providing, you should be able to have all the necessary equipment at home. The one thing you're going to need first is a stopwatch. So with maximum breath hold, the target here is trying to get to 30 seconds, maybe to 45 seconds, eventually to 60 seconds. You're going to take a deep breath, and in part 1 of the series, I talked about creating a waterfall, air coming in through your nose and filling up your midsection with air. So the most important thing here is filling up with air, holding your breath, trying to get to at least 30 seconds, and then building up from there, maybe 10 to 15 seconds per week. Once again, disclaimer, if you're dizzy, if you have any type of shortness of breath or any just changes in your status, discontinue the exercise. So the first thing I'm going to do is breathe in through my nose, and I'm holding my breath. Now I could have gotten a lot longer duration, but for time purposes, I wanted to stop. You would hold your breath as long as you can, trying to get, once again, to a minimum of 30 seconds. Use your stopwatch. Document your times. You can see change over time. So if you document your progress today, maybe you're at 27 seconds. Look at it again in a few days, maybe you're up to 32 seconds. Keep building from there. Exercise 2 and 3 are resistance blowing exercises. So these are working on the muscles for exhalation or expiratory muscle strength building. So I have 2 objects next to me. This is something that you can do at home. This is a 2-liter bottle of soda and 4 straws put together. In my clinic, I use more professional tools. I have oxygen tubing here in a 2-liter bottle as well. This is roughly cut to 42 inches, which gives me enough space to put it to the bottom of the tube and maintain good posture while doing the exercise. Because you don't want to decrease your accuracy of your posture or your posture alignment while doing the exercise. You want to make sure you're upright, your head, your shoulders are open in a good position to do the exercise. So you need adequate tubing or straw length to be able to do it. The first exercise is going to be a sustained blow for a stretch. So you're going to take your straw or your tube into a 2-liter bottle. Now, there are ways to modify the intensity. Based on the diameter of the tube, it gives you resistance, or the density of the water gives you resistance. There's 2 ways to change the loading of the exercise. Number 1 is simply lift the straw up to decrease the density in the water, or number 2, the diameter of the tube. So the first exercise, based on your comfort level, is going to be a sustained blow, trying to continue the airflow for 45 to 60 seconds. What I want you to try and do is avoid volcanoes. Volcanoes are changes in the airflow. So you may have low bubble bursting and then all of a sudden a huge burst of bubbles. Pretend you're in an aquarium. Keep a steady flow of bubbles coming through the tube, and that is the goal of the exercise. So I will start right now with exercise number 2. I'm going to take a deep breath in through my nose and just continue blowing through the tube for 45 to 60 seconds. And you would continue for 45 to 60 seconds. Of course, disclaimer again, if you're dizzy, if you feel just different, something not normal, discontinue the exercise. You are going to feel an effort level. And if it's too much, lift up the tube, decrease the density of the water. That'll decrease weight. So it's like lifting 400 pounds. And all of a sudden I lift up, I'm down to 100 pounds. Modulate the resistance based on the density of the water. We will start now exercise number 3. Now in exercise number 2, I talked about avoiding eruptions and keeping a steady flow of air like an aquarium. But in exercise number 3, we are going to do bursts. We are going to have eruptions of air. What I want you to make sure is that you're having greater awareness of your midsection. So when you're watching this video, watch my midsection. Every time I blow into the tube, based on the diameter of the tube and the density of the water, I'm going to naturally recruit my diaphragm, or the muscles that innervate the diaphragm. It's going to give me better control of expiratory force and cause better training to my respiratory muscles. I'm going to take a deep breath in through my nose, having that waterfall form into my midsection, and then blow into the tube. Make sure you stop breathing in between every repetition. You blow, stop, blow, stop, blow, stop. That's going to recruit these muscles to contract. Now, you can also modulate the effort level based on the density of the water. If it's too hard, lift up your tube. If it's not too hard, keep it at the bottom, which is 2 liters, and blow into the tube and contract your midsection. Okay, exercise number 4 is dynamic exercises with a breathing technique. This can be applied to various exercises. Today I'm going to show you some exercises that are related to breathing. I always want to open up the chest. I always want to strengthen the midsection. I always want to strengthen muscles in the back that prohibit forward shoulder recruitment, which causes more of a collapsed chest and directly affects breathing. The first exercise is called horizontal shoulder abduction, or simply just bringing the shoulders apart. The other component to this is the breathing technique though. I want you breathing in through your nose for 3 seconds. Then, when you're getting ready for the resistance component, you're either going to sustain a count of 5 of an SH sound, like shh, or the shh bursts, which is harder. So depending on your level, you'll either do the sustained, which is easier, or the burst, which is harder. I'm using TheraBand. There's 2 different types of TheraBand, a beginner or an advanced. I'm using the advanced. This is blue, there's silver, and there's black, all of which have different resistance levels. I'm going to take a deep breath in through my nose for a count of 3. I'm going to extend my hands out, lock my elbows, and bring my arms apart, squeezing my shoulder blades together, opening up the chest. Okay, the sequence though is going to be me doing 5 bursts of an SH sound while I'm contracting. And then exhale. Once again, inhale for a count of 3. And then exhale. Once again, discontinue if you feel shortness of breath or dizziness. You can modify the resistance level based on your grip. If it's too easy, come closer with your hands to increase your resistance. If it's too hard, distance your grip. If you have any shoulder pain or shoulder discomfort, stop right away. This is not supposed to cause pain, but it's opening up the chest and focusing on recruitment of the midsection when you're doing the shh, 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 shh sound. Another dynamic exercise is using the TheraBand for what we call a serratus punch. Once again, in episode 1, part 1, I talked about the serratus muscle, which is in the back, tends to be weak on a lot of people. So here's a good way to strengthen a muscle that helps with shoulder retraction, keeping the chest open, and working on some breathing techniques. Take a TheraBand, Put it underneath your armpits. Get a good grasp of the TheraBand, and you're going to punch. I want to make sure your pelvis is still, your back is straight, you're opening up the chest, my arms are extended. Here, my arms are fully extended, but I could always come forward more. That's the serratus muscle allowing for that movement. I'm going to take a breath through my nose for 3 seconds. Exhale. Inhale again. And every time that I was exhaling on the SH sound, I was pushing in with my midsection. I was punching and exhaling. So I'm working on a really good muscle in the back for postural support, but I'm also working on the midsection for expiratory force. Okay, this next exercise is called supine leg lifts. But to modify the exercise, you can always do unilateral leg lifts. But we're still going to incorporate the same breathing technique, which is inhalation for 3 seconds and those bursts or sustained SH sound based on your participation level at this point. So I'm going to lay down. I'm going to take a deep breath in through my nose, focusing on the midsection and the expansion of the midsection. I'm going to lift my legs and burst 5 times while my legs are elevated. And bring them down. If you're more advanced and you can do this, you can continue the exercise for 10 repetitions. And I'll show that right now. Breathing in. Exhale and lower your legs. So in conclusion of part 2 of a 2-part series on breathing exercises, we learned in part 1 the importance of nose breathing to filter the air, humidify the air, protect the airway. We also learned about the importance of stretching for better range of motion, opening up the chest, opening up the airway system. In episode 2, we learned about resistance-based exercises, various exercises that you can do at home using everyday materials, such as a bottle, a 1 or 2 liter bottle, tubing or straws, a mat, a floor, a stable surface on your bed to do these exercises. The importance of strengthening the respiratory system. Now you can incorporate nose breathing while going on a brisk 5-minute walk. The nasal turbinates are the little tubes in your nostril form resistance. Filters as well. You can alternate breathing through your nose for 1 minute while running, and then normal mouth breathing, if you will, because you need more oxygen in your system, and alternate that. If you like what you saw today, please subscribe so you get notifications to our next videos that are coming out. Like us, watch us, stay safe, stay well, exercise.